Well, I can just start by saying that it's my pleasure to interview Dr. TerryLynn Tennant today, not only as a doctor and as a skilled practitioner, but also as a patient today. And the reason I have you on this morning is to share with us a little bit from what you experienced as a patient in the past 30, 40 years that you've been involved in dentistry, and just share your story with us, please.
I'd be happy to. Hello, everyone. So my story, well, is getting to be a longer story. Just in terms of what we're talking about, in terms of airway and positioning and TMJ pain and that kind of history. When I was, very young, I was pretty clear that I had a pretty significant malocclusion. I had that class 2, division 1, where I had that, severe overjet with the laterals way to the lingual and with the canines way out, kind of like, vampire teeth. And so probably I would say 7th, 8th grade, the decision was made to go into orthodontics. Actually, it wasn't even full orthodontics. I was raised in a very small town. So my general dentist said, let's take out those 4 premolars and let's make some room for her front teeth to come into position. So they pulled 4 premolars and then used retainers with rubber bands, actually, and pulled my teeth. It pulled the canines back, pulled everything back and into position. And yes, it did. It gave me, straighter teeth for sure. Fast forward then until, gosh, when was I? Trying to think. There really wasn't until probably, 25 years ago when I, in my dental career, began to see a lot of treatment being done as far as sleep apnea was concerned. And so I decided to investigate that and take a look. And of course, lo and behold, I had myself tested, and guess what? I was very high moderate, right on the borderline of severe sleep apnea. So at that point, I went on a CPAP machine for probably about a year as I continued to do some research and work with some more patients. And then I made myself, and then over the next 4 or 5 years, I went into an MAD device. And
so nobody suspected that you had sleep apnea because you were not overweight, you were not showing a lot of not complaining of daytime sleepiness and things like that, that most doctors, most of our MDs are waiting for those clues before they diagnose something. So you went right under the radar because you were in good shape, and so you just decided to test yourself with the knowledge that you had.
Yes, exactly. Wow. Now that reminds me, because as we know now, airway issues can be responsible for many systemic issues. And actually about age 30, 31, I actually did struggle with some clinical depression. And of course, there were some life changes that happened. And so it's always easy to blame that on those things. And the fact of the matter is, at that very same time, I began to experience very severe insomnia.
Oh, okay.
So I would wake up after 2 or 3 hours of sleep and not be able to go back to sleep. So it actually got to be a pretty serious problem. And
so a lot of people like you, they think it's psychological, they think it's the stress in their life, they pop in medication, and they don't realize that is actually your space that just got so small after those extractions that you just didn't have enough room for your tongue and for your airway, correct?
Exactly, for any of it. And so at that time I went on, medication, and was on medication, for another, I was 30, 31 at the time. So another 20 years I was on medication until I had my diagnosis of sleep apnea.
Wow.
And even at that point, we still didn't know about what were the possibilities to treat sleep apnea. And so, of course, I went through many different MAD devices. I wore the SomnoMed, I wore the Tap 1 and the Tap 2. And so, and certainly I would
were
take
the majority of them to just bring your lower jaw forward to open up your airway? Okay.
Bring my lower jaw forward. Now, something I've neglected to mention was in those late 20s and into my early 30s, I also developed TMD pain pain on both sides. And so I was always having to be careful about what I was eating, what kind of hard foods I was eating. Didn't really experience much headaches, but it was always, you know, right in my joints. So that was another issue that went along with this all this time, up until about 13 years ago, when I actually bought a dental practice that had some patients that were actually being treated with this strange device called the DNA device. And the theory was that we could actually turn on stem cells in our midface and actually grow our midface forward and open up airways and actually diminish and or eliminate sleep apnea. Wow.
So because you were connecting the smaller size of your face, mid-face, and your mandible, the smaller size was causing the airways to be restricted, right? And not good airflow through your nose, probably nasal cavities, sinuses, everything shrinks, it's all connected. So if the palate is shrinking and getting smaller, the whole mid-face gets smaller, right? And it can affect tongue posture.
Absolutely. Okay. And another couple of other symptoms were a lifelong mouth breather. Always through my mouth, always had issues with snoring. Mm-hmm. Always, my kids would tease me, you know, about, well, Mom, you were really sawing logs last night. So, you know, just a lifetime of these issues that go along with sleep apnea.
Yeah.
So what a revelation it was to learn and meet Dr. Dave Singh, who at the time had started a small company to educate and teach dentists about this process, about the epigenetics of sleep apnea and the mid-face and genetics and how this all worked together. And so I learned, and I, sorry guys, I'm camping. We're
bringing her from a beach house, yes, on a beautiful lake, Devil's Lake, right?
Devil's Lake, yeah.
Well, thank you for joining us today and taking time from your vacation to share.
It's my pleasure. It's my most favorite thing to talk about in the whole world. So we fast forwarded, and I began to learn about epigenetics, and I began to treat patients. And I did, you know, I would say, I don't know, 10 or 20 cases in that amount of time, because as a small company, we didn't have a lot of teaching seminars, just resources to learn more, and also to just gather, you know, our information and do research. Mm-hmm. It was about, gosh, 3 years ago now, that Vivos came in and saw the absolutely wonderful things many of us were doing with these appliances, and they purchased the company from Dr. Singh, who still is very active in the company as our chief medical officer. He's now free to do all of the research, and as participating dentists, we are all now keeping very, very clear statistics on all of our cases in terms of where we start, CT scans to measure all of the three-dimensional functional spaces that we know are diminished when we have a very small midface.
And that airway intelligence report is so sophisticated, so comprehensive. I have to admit, I have rarely seen orthodontists get so much in depth into airway, you know, and looking at that CT scan and looking before they start the ortho treatment. So, you know, I'm really impressed with those airway intelligence reports.
Yep, many orthodontists are still really doing their calculations and predictions on just a Ceph,
Mhm.
cephalometric information, where really I believe it's getting to be state of the art that we all take a look at these three-dimensional pictures, where we can really get a good three-dimensional look at what size the airway actually is, both in terms of volume and in terms of size. So yeah, it's very, very in depth in terms of the information that we look at and follow all the way through a case.
With the CT scans that you do for every patient.
Yeah. Yeah,
Yes.
CT scans, and also, of course, photos. We've also learned as dentists to not just look right into this oral cavity. We've learned to step back, and we've learned to take a look at a person's full body and look at their face and look for asymmetries in the size of the sides of their faces. Where do the ears match? Where's shoulder from the side, from the lateral side? Where is that head position? Clear on down to where do our hips line up? So we really aren't just focused on the mouth anymore. We're really looking at whole body treatment.
Yes. So you started reversing basically what ortho had done as far as making your mouth smaller. You started reversing that by expanding the palate three-dimensionally, right?
Yes,
And
three-dimensionally. And we can fast forward to this most recent year, as I have continued to expand, and I actually now, in terms of my testing for sleep apnea, I've actually come down to mild sleep apnea.
wow, that's wonderful.
And have opened up more than 2/3 of my premolar spaces.
Mm-hmm.
And you can't see them right now because I have a set of your myoaligners in,
Thank you.
which cosmetically improve my smile to absolutely a beautiful, beautiful, beautiful position.
I bet you a lot of our orthodontists would like to see those gaps, if you don't mind sharing that with us, because it shows how you're now opening spaces for those bicuspids that were extracted.
Mm-hmm.
And
yes.
Oh wow, look at that. Yes.
Yeah.
Almost. And then you also have severe curve of spee or bicuspid drop off. So as this jaw got smaller, as the upper jaw got smaller, lower jaw was retracted, and then
Mm-hmm.
you don't have much of a height. So what we did for Dr. Tennant is that we found her physiologic rest position by resting her mandible. We used ALF-10's ultra low frequency electrical neural stimulation. Wow, look at that. And so she's still growing her upper jaw. And what we did was just aesthetically, not only covering that, but also maintaining that vertical dimension of the occlusion in that position. So I made her a set of myoaligners that goes on the right and left side. You didn't even let me adjust it. You just took it out of a box and put it in your mouth.
Took it out of a box and put them on and went, oh, this is wonderful. What's wonderful about them is that it increases my vertical. I'm really at physiological rest, and I don't even take them out to eat. I actually eat with them in because I'm just so much more comfortable. So
and that really jumpstarts the bioremodeling that Dr. Singh focuses on so much, because when you're functioning in the correct position, your jaw remodels, and if it's just a nighttime appliance, we can do a lot of remodeling, but it might not hold that joint in a good stable position. So during the day or at night, can you wear your DNA with these myoaligners if you want to?
If we designed it that way. Now, in my particular case, we made these for me after I already had my DNA appliance, and so I just used my DNA appliance or my myoaligner during the day, and I take my myoaligners out and put my DNA appliance in during the night.
Yeah. So it's a segmented design that's really helping you continue to grow until we're ready for implants. So
and now I feel so much better about a big smile because my gaps have been getting so big. even my kid said, Mom, your mouth doesn't look very good anymore. So now I have my smile back.
And I know that's a concern for a lot of our patients, going through DNA, because they are opening up those spaces, and aesthetically, it's not that good. And so they have a solution. With Myoaligner, we can just take them through that phase, keep the jaw stabilized until you're done with ortho, and then we know if you need to do extrusion, right, or any restorative on that.
Exactly. Exactly. What's wonderful about the segmentation of the myoaligners is that it just intersects with the Vivos appliances, because as we know, as Vivos providers, when we expand the jaws, everything stays segmented. And so everything moves in segments. And so these posterior segments move either, down and forward or however they're going to move, but they stay together. And so my myoaligners continue to fit all the way through. As I open up, I may open up just a little bit more space, but we could come back and bond some composite onto those if I felt like I needed to fill those in. So, I mean, they're just incredible. I'm so thrilled to have them.
Thank you. I know you've used it for some of your crossbite cases that were, you were expanding during the night, and then the expansion could reverse during the day because of normal occlusion.
Right.
So how did you design it for your lower, for those cases that you're treating bilateral crossbite?
Well, a bilateral crossbite, and we certainly are trying to expand, but what we don't want to have happen is we don't want that crossbite that's going on during the day to move those teeth back in and reverse that. So what we want them to do is get we set them up with a set of myoaligners to start with, so that they have that for day wear, and then they have their DNA for night wear, and they can also wear their it's set up against the myoaligners because often we want that DNA appliance in for several hours during the day too. So we set that up with their myoaligners and keep those myoaligners in during the day, so that we can continue to expand. Here we are.
I think everything just slowed down. I think it was internet connection, but it was a big emphasis on expansion. So I'm going to go with it, and I'm just going to keep it. It's a slow-mo expansion. Wow, I cannot get over that smile. I love looking at your teeth now. We've known each other for almost 3 years. We met at one of Dr. Singh's classes. And I think I remember your bicuspid gaps from there.
Even then.
Yes,
Even then.
What is your advice, for all the young orthodontists graduating, or for those that graduated many years ago and they're not really paying attention to airway? I'm sure you've had many patients who've been down this path just like you. They've spent thousands of dollars having braces on, and then if there's not a lot of attention to their airway and the correct orthopedic alignment, then they end up having to reverse all of that, which is costly, which is disappointing, years of suffering, anything from physical to psychological, issues, because it can affect the sleep. So what is your advice for these younger orthodontists?
Certainly, I would first of all commend all of our orthodontists for everything that they've done and everything that we've learned to do. Exactly. I did some orthodontics myself as a general dentist, and I know that it's not always easy, for sure. So I get that. And we know now that it's about education. It's airway is so important. We know that the American Academy or Association of Orthodontists came out with a white paper almost a year ago recommending that all orthodontists consider airway as they do
great news.
Planning. Yes. And so I just would so encourage all of you to jump in and look at some of the sleep medicine education that's out there. Take our Vivos company is one that has an enormous amount of education on airway. on epigenetics, and just take a look at what's out there, because you're just seeing more and more and more emphasis on airway. In our company, we have several orthodontists now who have taken a look at this and have looked at what they've been doing. They've taken it into their practices, and they are absolutely expanding and making larger airways now. And our orthodontists will fully admit that they didn't know what they didn't know, and they were doing the best they could. But now they're seeing some of their patients who've returned and have continuing or new onset of TMD problems. They look at those cases now and say, wow, we have an underdeveloped midface. We have to take another look at this, and we maybe have to go through another course of orthodontics. And it's okay. It's really okay if we can help people and increase the amount of oxygen that they're getting every night of their lives when they sleep. Not to mention take care of that pain in those TMJ joints, headaches that go along with this underdeveloped jaw, neck aches, migraine headaches. What an amazing thing you as orthodontists can do, not just make beautiful teeth anymore, but make beautiful lives.
That's true.
What a gift.
Yeah. And I know many orthodontists actually do pay attention to airway, but they achieve the same results surgically, right? They send the patient in cooperation with an oromaxillofacial surgeon. They do their jaw expansion, the Lefort procedures. So how is it different? What advantages do you see in a slow bioremodeling as opposed to surgery?
Well, anytime you're considering, a surgical procedure, something like a Lefort or a mandibular advancement, all of us know what kind of risks are involved in that. You certainly have issues around, numbness and a pretty severe recovery period, et cetera. What I like about and I do want to preface that or preface what I'm going to say by, and in some cases, surgery really is the way what needs to happen for proper treatment. And in my hands, a biomimetic appliance that mimics the growth, the potential that our genes have for us to actually turn on the development that didn't happen and hasn't happened for several generations behind us, to actually turn that on, those genes, and have that face grow naturally. To me, that it's just so much healthier and more, much less consideration of surgical treatments and the side effects that can come along with that.
Mm-hmm. That makes sense, But I think there's more research on bioremodeling happen mostly in younger adults, adolescents, that they don't really believe that it can happen in adults. And you're a perfect example, of an adult going through this. So I'm just hoping to see, even on the ortho side, more research on adults, bone remodeling, and more on epigenetics.
Absolutely. I just had one of my colleagues send me a picture, send me an airway intelligence report, a beginning and ending report. 80-year-old cardiologist who went from and he himself had heart issues, went from severe sleep apnea to very low mild in 12 months.
Wow.
He's over the moon. He's just over the moon. And to look at not just his airway, because you can certainly see the increases in the airway in that three-dimensional film, but to see his face and what his face looks like a year later, after he has been opening that airway and getting the appropriate amount of rest and sleep at night, he looks like a different person. In 1 year, that man looks 10 years younger.
At age 80, it is amazing. Well, with a good compliance, you gain 1 millimeter of bone a month. So 12 months is, 12 millimeters is a big deal. 1 centimeter in the face is a huge difference.
Oh, it's huge.
And in the airways and, the nasal breathing.
Absolutely. We know that if we're looking at this upper jaw, we know that even 2 millimeters of forward movement can create, I don't know, 150, whatever it's, whatever a volume in that
Oh,
airway.
cubic
Millimeters, I
cubic
guess.
millimeters, and yes, wow, of
Yeah.
volume of
Yes.
air. Wow, that's
Volume of
amazing.
air. Yeah, it's
That's
huge.
amazing, especially now when we are facing this pandemic. What is, I always tell my patients, your nose is the best built-in HEPA filter, and if we're not using the nose to breathe, we can invite all the bacteria, viruses directly into our lungs, into our throat, but when we breathe through our nose, when you can breathe through your nose, when you have big enough mid-face that you can easily breathe through your mid-face, breathe through your nose, that really boosts your immune system, doesn't it?
Absolutely. We haven't talked much about that this morning, but remember that the mid-face encapsulates all of your nasal sinuses and all of the septum and all of the air spaces in your nose. And so when we have underdeveloped nasal passages, then we have so much more mouth breathing. And we know that nasal breathing actually increases and maintains the nitric oxide balance that we need to have in our blood and and then of course into our breathing. So
exactly.
Again, that's actually when I do my epigenetic appliances, that's actually within the first 2 or 3 months. And because we have so much cartilaginous, tissues in the nose, that's actually the first thing that my patients all notice. They'll come back and they'll say, wow, what I really am noticing is that I can breathe through my nose and it feels so much clearer. So that's really, again, another huge piece of why we think this is just so helpful and helpful.
Yeah, and the nose is the only body part, the nasal cavities are the only body part that release nitric oxide gas, which is a huge disinfectant. It kills all the viruses, that are trying to enter our body. But if they're mouth breathers, they lose the advantage of nitric oxide. And I've seen nitric oxide pills. People are popping nitric oxide pills, not realizing that a few good deep breaths through their nose is going to increase their nitric oxide level. And
yes.
Oxygen intake at the mitochondrial level, actually, right? At the cellular level and mitochondrial level. Yeah.
Many studies out there, because we're learning so much about all of these different systems and how nose breathing has become so important. You'll see now many elite athletes are they're training differently so that they can actually train at full capacity through their nose because of nitric oxide.
Yes, it's amazing to see the difference with something like a nasal breathe right strips or the mute that just expands your nose slowly a little bit to see the difference in oxygen intake, But once you correct the structure and have the bone grow, then you'll be set for a life long, and feel healthier, feel more alert.
That reminds me to speak about how this process is such a multidisciplinary process.
Exactly.
Because often we're the first ones who've done a CBCT scan, and so we're looking at all of these things three-dimensionally, and very often we will see pretty severely deviated septums. We can see spurs in the TMJ joints. And we know that with some of those things, it's very important that we bring our ENTs on board and we get them involved and them looking at these things and helping, maybe a surgery to fix that deviated septum is something that we really need to do, if not at the beginning of treatment, so we can get this nasal breathing happening, but maybe, as we go, as we see things begin to open, but they're not breathing as well as we would want them to.
It's amazing that good nasal breathing is the key to health. I mean, you cannot survive without oxygen or without breathing for 5 minutes. It's that important, and it's unfortunate to see the majority of our society, majority of our patients not be able to actually breathe through their nose. The breathing is a big issue, and you and I have talked about it several times. It can be the precursors for many diseases: diabetes, sleep apnea, ADD, ADHD. All these modern diseases that we see can be related to lack of oxygenation, because unfortunately in modern societies we do not learn to chew our food, we do not learn to strengthen and to develop our muscular structure in the head and neck or our face, and we're getting smaller and smaller here, which is I think the source, the cause of all of our modern diseases.
Absolutely. You know, I'll add to that. In modern cultures, we don't breastfeed our babies
Yes.
nearly as long as we used to. And so
This week is actually the breastfeeding week. So this is nice that you brought this up. Yes, and we don't breastfeed. There's a lot of shaming, going on with, used to be shaming going on with breastfeeding, because, and I think some of these bigger companies that are in there for profit, they were actually encouraging mothers to put their kids on formula. And please tell us, how does breastfeeding, not just being on formula, changes the oral structure?
Well, what happens with the mother's nipple during the breastfeeding process is absolutely the perfect shape to create good swallowing for that baby, and that baby's tongue is being trained to form up against the roof of its mouth as it's taking in the milk, and so that palate has that nice pressure on that mid-palatal suture, and it creates the growth to happen during breastfeeding. That's why that's so important. It also then, as that happens, the baby has learned to swallow appropriately, and learn and gets that tongue into the roof of their mouth from a tiny infant, and then that tongue stays up there in a proper swallowing pattern and continues to act as a scaffold for the dental arches and when the teeth start coming in. And so that we know that nursing really can help form that nice, wide, shallow palate.
That's wonderful. Well, I can talk to you forever about this. We're so passionate about this, but I understand you're on vacation. We don't want to take up much more of your time, but it's been an honor to help patients, and collaborate with you, especially since this winter that we joined practices together. It's been wonderful to put our heads together and help some of these complex cases of temporomandibular disorders and airway. And I couldn't be happier.
No, it's just been a wonderful collaboration, and we're just going to do this for a really long time.
Yes.
We're going to save lots of lives doing this.
Yes, yeah, I'm looking forward to that. And that smile is beautiful. I can't get my eyes off of it. Well,
thank you, Dr. Matlaw. Nice smile.
Well, it was so wonderful to chat with you this morning, and thank you for your time, and we'll pick up more. Okay,
see you
bye-bye.
Bye.
Bye. See you soon.